Hi there, I'm Dr. Kristina Tansavatdi, and I'm a double board certified facial plastic surgeon. I specialize in deep plane facelift and neck lift surgery, and in my consultations, I often get a question about where the incisions are placed for a neck lift surgery. So I want to kind of dispel the myths or the concerns that people come in asking about. And one of the questions that patients worry about is where the incisions are placed for a neck lift, because they're trying to get the outcome they want without having it visible to other people. They're afraid of not looking natural. They're afraid that people will see the incision or the downtime they might have. But let me tell you about why facelift incisions or neck lift incisions, why we have to place incisions in the front of the ear to chase the skin. Because one of the things I do very frequently is to revise previous facelifts and neck lifts. And when I do test the skin and I'm checking out why there's still some laxity in the neck, one of the reasons is because the work has been done in a pulled fashion backward. And when we put incisions behind the ear to try to eliminate the possibility of it being seen, the result being seen, well, you're actually countering or getting a subpar result when you're trying to do that, because it's as if you're trying to cut a corner around things. So when you age, things are falling downward. Gravity is pulling it in a vertical direction instead of it falling sideways, right? Nothing falls sideways. Yes, you're getting jowling, yes, you're getting bands, but all that is in a more vertical direction. So when we try to pull in a incision, place the incision behind the ears and avoid this front portion, and you've got all this loose skin, well, then what you're going to be dealing with is that you're going to have some bunching, or when you bend your chin down, there's going to be some bunching of skin, and that looks unnatural. So now you're trying to place an incision that's less visible, but then you're not able to chase out all the skin, so now you have bunching when you bend your chin down. And I see that very frequently. I'll be outside and I can see when somebody's had a facelift or a neck lift procedure that's not done well, because I could see when they bend their chin down, and now you got bunching of folds of skin along the side of the neck or side of the face. And that's not what you want. You want a natural result. A natural result, if you've had a lot of loose skin, is going to have to be chased in an upward direction. And sometimes I have to chase the skin up into the temples even. And if you look at before and after photos, if it's done properly, you won't have a clue that a facelift procedure was done. If it's done well, the placement of the incisions is done well. The problem that I see is when patients are trying to get the result and trying to fit a square into a round hole. So that's not the way we want to address this, and that would be a disservice, because now you're dealing with a more visible outcome in the face and neck that shows that there's still bunching of skin. Now, could you do a procedure without having to do in front of the incision? Yes, and I'll explain it. It's in the right patient. So you have to be a patient that has better skin quality. The skin has good bounce back. You can see the elasticity of my skin. So in those patients, I may not need to put an incision in front of the ear. It may just be right around the earlobe and that's it, and you wouldn't need that front incision. But in a majority of cases, when I've seen patients, I would say 2/3 of my patients are older, they're above the age of 50, and they've got some loose skin. And we now have to chase that loose skin somewhere. And that loose skin normally has to go in an upward direction rather than just pulling back, okay? And pulling back is going to lead to problems, because you're going to have some bunching in that face and neck on the side, and that's very visible. Well, there you have it. That's a long-winded answer to a question that I get and a concern that I have when patients are trying to get the result they want with a less visible incision. And really, you should be looking for, how do I get the best result, period. Got that? Best result, period. There you have it. Thank you for tuning in, and please follow me at my YouTube channel at Facelift Expert, and for more videos you can tune in there, as well as my Instagram channel. at Faces by DRT. Thank you so much.